Okay, so this is the last part of the module that we'll be talking about today is focused on older youth. So youth aging out of the foster care system. Specifically in this context of permanence, what happens to youth who age out without this permanency? So if we remember, we're thinking about permanence as primarily adoption, reunification with caregivers, or a transfer of legal guardianship. So someone has become their legal guardian. There are older youth in foster care that fall under that APLA, where they have not found permanency through any of those options. And so they age out, what's called aging out of foster care. They're emancipated, become adults without that permanency. Each year, approximately 20,000 kids age out of the foster care system, so they're exiting care without any of those permanency options. So we're going to focus now on what happens to those kids that are aging out of the foster care system. There's many indicators that research has shown that they're at much greater risk across many domains for negative outcomes. Less than 1 in 5 of these youth are completely self-sufficient when they leave foster care. So again, some states they're leaving when they're 18 or 21 in some states, but yet they're leaving, they're on their own, but they're not self-sufficient. 1/4 of these youth who age out are reading at a 3rd grade level or lower when they age out of foster care. 1/3 of those aging out have no high school diploma or GED. Research studies that have looked at this, especially the Midwest study by Mark Courtney, have indicated that after 1 year of aging out, only 40% of foster care alumni are currently employed. So many are experiencing high rates of unemployment. And again, much of this research comes from Mark Courtney at Chapin Hall. And this was a longitudinal study. So he was able to begin with 732 youth in 2002. And he compared youth who stayed in foster care after the age of 18. So again, some states have extended foster care up into the age of 21. Through the Fostering Connections Act, this is available to all states now. Some states have chosen to do this, some haven't. So he was able to compare outcomes for these two different groups. What he found was youth who stay in care even for 3 more years, up to the age of 21, are more likely to go to college. They have increased earnings for each year. So even if they just stay, there's incremental benefit. If they stay in care for another year, they have greater increased earnings, and that continues. And they are at lower risk for things like early pregnancy. And so there are significant benefits that he found in his study, an ongoing study that tracks these kids over every couple of years to see what their outcomes are, how are they doing after they've left foster care. So before the Fostering Connections Act, there was the Chafee Foster Care Independence Program, and this was significant. This doubled the federal resources for independent living programs. It provided flexible funding to states so that they could provide specific services to this group of youth. Beginning, I think most begin age 15. So if a child is age 15 in the foster care system and they do not have a permanency option, they can receive some of these independent living services. It also enables states to provide housing assistance to this 18 to 21 group, and also medical benefits. So housing assistance and being eligible for Medicaid up through age 21, and we'll see that that's now been extended too. So we have the Chafee Act, Fostering Connections Act of 2008 has augmented some of these programs. It's extending the eligibility, as I mentioned, for foster care payments so that you can stay in foster care or receive foster care child welfare services up to the age of 21. The goal is to provide stable housing, make sure that youth have stable housing, have access to higher education, are completing high school, have health care coverage. And so the goal is to really make sure that as youth are transitioning into adulthood that they have some of these supports in place. What else Fostering Connections Act does is it requires states, so all agencies must have a transition plan in place 90 days before discharge. And there's a list of things that must be included, that they've addressed these things with the youth and helped them plan for things like housing, health insurance, education, some relationship with mentors, workforce, and employment services. So there's a checklist of things that have to be in place before youth ages out of foster care. And so this is a mandate, a federal mandate that states must do. It also extends eligibility for children placed in kinship. So some kids in kinship care that had experienced a transfer of guardianship were not eligible for this extended stay in foster care, and so weren't eligible for some of these services like housing and Medicaid. So that has changed that. Now those children are also, and youth are also eligible. Another piece of this is that I've been looking at, this is part of my research, is also looking at the importance of just social support and connection. So, looking at how connected youth are to caring, supportive adults. Again, this is probably intuitive, but there's research that indicates that youth who are connected have better outcomes. Youth who don't have that, so youth who age out without these connections, as we just saw, they're at an increased risk for incarceration, dropping out of school, homelessness, poverty. But we do know that youth do better when they're connected to caring adults. And this is including the foster care youth as well as youth in the general population. Studies have linked these connections to improved chance of better self-esteem, improved mental health outcomes, improved school success, social skill development, so having positive supportive relationships with caring adults can transfer to positive peer relationships, positive intimate relationships. And so we know in general that youth do better when they have those positive interactions with adults. We also know that youth do better when they have those supportive adult connections as they're transitioning to adulthood. And this idea of emerging adulthood, that that there's young adults really are slowly emerging into adulthood up until the age of 26. And so if we think about some of the policy changes up to the age of 21, they've made improvements, but they're still not supporting youth through that whole transition process. So having supportive adult connections through that transition, if we think about that, thinking about what that would mean, financial supports. So having a place to stay for a few days if you don't have money to pay rent and you get kicked out. Do you have a place to stay for a little while? Do you have someone you can go to for just a little bit of extra cash as you're maybe looking or in between jobs, or you just need a little bit of extra help in a certain month? Do you have kind of that financial safety net that can really make a difference between being homeless or not, for example? So do you have the financial safety net? Do you have the social and emotional safety net? Do you have someone to go to for the holidays? Do you have a place where you feel at home? So having that emotional kind of home base, that emotional safety net is really important, which relates to this last piece of, having a sense of belonging, just knowing who you people are, where you came from, where you're going, having a sense of belonging, people that you belong with. And this may be, partly maintaining your cultural identity, racial identity, however your culture is defined, but having that sense of belonging, where people have claimed you as one of their own as well. And this, you're starting to see a shift in this. So even this idea of independent living programs, some have challenged the system to really think more about interdependence, that it's not this question of are we independent or not, but that we always rely on other people. And so promoting that is even agencies, as you're working with youth, while they have extra support, promoting these social skills and interactional skills so that they have this ongoing safety net and supports. And so those are ongoing efforts through things like extensive family finding, helping youth identify adults that are important to them, again, while they're in care and have the supports they need, to identify and engage those supportive adults. Maybe they're not a permanent placement for them, but they can provide some of these types of, kind of a circle of support, a safety net for them as they're transitioning to adulthood. Okay, so that wraps up our discussion today about permanency. Again, you can go back to Blackboard and finish the module, and then we'll have finished our discussion on permanence, adoption and permanence for children in foster care. Thanks.